In the previous video, we introduced scenario assessments as another qualitative method.
Let's look at an example of how this indicator table applied to a scenario assessment conducted in late 2025 in response to the Marburg virus outbreak in Ethiopia. Initial drafting of scenarios and the indicator table relied on past viral hemorrhagic fever scenario assessments and historical outbreaks as a baseline for what scenarios could potentially occur in this outbreak. The team then used current outbreak evidence provided by response partners, which indicated that the growth rate of the outbreak was slowing, that there was uncertainty about known chains of transmission, that contact tracing efforts were underway and extensive, that reporting was indicating that treatment centers were activated and case isolation was ongoing, and finally that a case outside of the outbreak epicenter had been reported. Based on this evidence, they drafted this indicator table and shared it with disease and response subject matter experts for further input. Key areas of uncertainty were identified and documented along with this table, including effectiveness of surveillance efforts, potential for undetected chains of transmission, potential for spread, and availability of medical countermeasures like treatments and vaccines. Based on all these inputs, the team determined the most likely scenario to be Scenario A, an outbreak with fewer than 30 cases and lasting less than 3 months. Quantitative modeling insights can also be incorporated into a scenario assessment when appropriate and available to answer key questions like, how effective could the available interventions be? What are the most important sources of uncertainty in the outbreak? And how much of what we don't know will impact its progression? Modeling can be included in a range of ways, depending on data availability and questions of interest, including through modeling literature, illustrative modeling, and scenario modeling when possible. To build upon the Marburg scenario assessment example, the team developed a mathematical branching process model to explore what observed cases may tell us about the true number of infections and what this means for how the outbreak may progress. The model projects total case numbers over weeks and months under different assumptions about the effectiveness of outbreak surveillance efforts. We examined the relative probabilities of the 3 outbreak scenarios, A, B, and C, at 90 days after the first reported case. Model results showed that our assessment of the relative likelihood of each scenario occurring was highly dependent on our assumptions about surveillance effectiveness. Surveillance effectiveness was a key uncertainty in our assessment, and the modeling helped reiterate the importance of highly effective surveillance on outbreak mitigation when communicating with response leadership.
All qualitative assessments and modeling have some limitations and assumptions, but incorporating both can bolster outbreak response decision-making.
To conclude, scenario assessments can be key resources for outlining potential outbreak trajectories in coming weeks to months, especially early on when data are limited.